One of the things I get asked is, do you do the SFMA on everybody that you see? And the answer is yes. But a better question would be, when do I do the SFMA on everybody? For example, if a patient came to me or a client came in that was status post a rotator cuff repair, maybe 7 or 10 days, I'm certainly not going to put them through a movement assessment. I'm going to treat them with the tools in my toolbox that I would have always used. However, when the patient gets full passive range of motion or pain-free range of motion, then I would run them through my SFMA to find out what movement patterns or what impairments might have been present that caused the problem in the first place. Now, along the same lines, we talk about the SFMA. It's a tool that looks at these gross movement patterns. And initially, when we run through our base screens, we're looking for what I call the elephants in the room. You're looking for that 800-pound gorilla in the room. You got to take your thinking cap off. Look for the big picture first. Let's find the elephants. And then once we get the elephants lined up and we know what the regions we need to assess, we'll now run you through additional breakouts and get to the very specific impairments that are causing the problem. Now, most people that we see in the real world, there's going to be at least 1 or 2 elephants that we're going to deal with. It's all going to trace back. We're going to have triangulate. We'll get to the same impairments. But then we go to the other end of the spectrum. What if we're dealing with an elite athlete or our athletes in colleges or other places that we see? We can still find movement impairments on these individuals. They're just on a lesser scale. So instead of maybe looking for elephants, we might be looking for mice in this place. But we can still find minor disturbances in their movement that could be secondary to some impairments somewhere within the body. We find those impairments, we put them on corrective exercises, and we run right back through our gross assessments to see if we restored normal or functional movement patterns.